The mind, much like an ancient garden, can sometimes feel shrouded in a gentle mist. We step into a familiar room, a thought fluttering just out of reach. We search for a word, only to find it has momentarily vanished. These moments, these small, unsettling slips, can spark a quiet whisper of concern within us, especially after we've journeyed past 60. Is this just the natural ebb and flow of time, a gentle slowing down that is to be expected? Or is it something more, a subtle sign, inviting us to pay closer attention? In this episode, we will embark on a calm and clear exploration of brain fog in our seasoned years. We'll gently distinguish between the ordinary forgetfulness that comes with a life well lived, and the early signals that might suggest a deeper cognitive shift. Our aim is to provide clarity, not fear, and empower you with knowledge to nurture your brain's vitality as you age. Imagine your mind as a bustling city, alive with connections and pathways. Brain fog, in essence, is like a soft, persistent haze descending upon this city, dimming the vibrant lights and blurring the intricate routes. It's not a disease in itself, but rather a collection of symptoms that signal a temporary clouding of your mental clarity. You might notice a struggle to concentrate, a feeling of dullness, or a persistent fatigue. That mental effort seems to deepen. Memories might feel just beyond your grasp, and the effortless flow of thoughts might seem to falter. This phenomenon, often described as having a head in the clouds, can be particularly concerning for those over 60, as its symptoms can sometimes mimic the initial signs of more serious conditions like dementia or stroke, underscoring the importance of understanding its nuances. What are the gentle breezes that stir this mental fog, particularly as we mature? The causes are often multifaceted, a delicate interplay of various elements. One significant factor is subtle inflammation within the brain's delicate network of neurons. Even a tiny spark of inflammation can disrupt the smooth communication between brain cells, leading to a noticeable dip in cognitive function. Think of it like a whisper that gets lost in a crowded room. Another crucial element is the flow of life itself, blood circulation to the brain. When the supply of blood, rich with oxygen and nutrients, dwindles, brain cells can become compromised. Conditions like arteriosclerosis, which narrow the blood vessels, can reduce this vital flow. When blood doesn't circulate freely, the brain struggles to clear out waste products, such as amyloid beta proteins, which are implicated in memory decline. This buildup can damage brain cells and contribute to that foggy sensation. Chronic health conditions can also cast a shadow. Underlying issues like anemia, where your blood lacks healthy red blood cells, or an underactive thyroid gland, can subtly affect brain blood flow and intensify feelings of brain fog. Similarly, certain medications, even those prescribed for your well-being, can have side effects that dim your mental sparkle. Antidepressants and antihistamines, for instance, are sometimes noted for their potential to induce or exacerbate brain fog. Life's natural transitions, particularly hormonal shifts, also play a role. For women, the decline in estrogen during menopause can lead to a more pronounced experience of brain fog. In men, certain hormonal interventions, such as those used for hair loss, can also contribute to hormonal imbalances that affect cognitive clarity. Surprisingly, even the ecosystem within our gut can influence our brain. A condition called small intestinal bacterial overgrowth, or SIBO, where bacteria multiply excessively in the small intestine, can cause inflammation in the gut lining. This inflammation can, in turn, send signals to the brain, contributing to that sense of fogginess. The gut-brain axis is a fascinating connection, reminding us how interconnected our bodily systems are. The demands of modern life also contribute. Chronic stress, a constant companion for many, can profoundly impact brain function, contributing to the development of brain fog. Our brains are designed to handle short bursts of stress, but prolonged exposure can lead to mental exhaustion and decreased clarity. And then there's sleep, the brain's nightly rejuvenation ritual. Insufficient or poor quality sleep is a major culprit behind brain fog. During deep sleep, our brains engage in vital repair and clear out accumulated waste. Without adequate rest, these processes are disrupted, leaving us feeling sluggish and mentally cloudy. Aiming for at least 7 hours of restful sleep each night is not just a luxury, but a necessity for brain health. Our plates also hold profound influence. A diet heavy in fried foods, Processed snacks and excessive sugar can fuel systemic inflammation throughout the body, including the brain, thereby worsening brain fog. Conversely, a diet rich in whole, unprocessed foods can be a powerful ally in maintaining mental sharpness. Finally, the lingering effects of illnesses, such as long COVID, have brought brain fog into sharper focus for many. Post-viral symptoms, including brain fog, are often attributed to the body's ongoing immune response, which can lead to neural inflammation. This reminds us that our brain's well-being is intricately linked to our overall health, and how our body responds to invaders. How does this mental mist manifest itself? The symptoms of brain fog can be varied, often overlapping and sometimes subtly appearing. A primary sign is a noticeable decline in cognitive function, difficulty concentrating, a persistent feeling of mental dullness, and a general slowing of thought processes. Short-term memory lapses, like forgetting why you walked into a room, or misplacing everyday items, become more frequent. Beyond these, there's a pervasive sense of mental haziness, a feeling that your thoughts are not as clear or sharp as they once were, as if a veil has been drawn over your mind. Physical symptoms often accompany this mental cloudiness, including chronic fatigue, persistent drowsiness, headaches, and even dizziness. Some individuals might experience sensory changes, such as a diminished sense of smell or taste, particularly those recovering from viral infections. Neurological symptoms like tinnitus, ringing in the ears, a feeling of fullness in the head, sleep disturbances, dry eyes, and even blurred vision can also be present, highlighting the broad impact of brain fog on the nervous system. For those navigating academic or intellectually demanding tasks, a profound sense of mental fatigue, almost like burnout, can set in. So, how can we gently lift this veil and nurture our brain's clarity? There are several compassionate and proactive steps we can take. Regular physical activity is a powerful tool. Engaging in at least 150 minutes of moderate exercise or 75 minutes of vigorous exercise per week can significantly improve blood flow to the brain and reduce neural inflammation, helping to disperse the fog. Think of it as gently aerating your garden. Embracing an anti-inflammatory diet is another cornerstone of brain health. This means consciously reducing your intake of fried foods, highly processed items, and excessive sugars. Instead, lean towards a diet rich in omega-3 fatty acids found in fatty fish, an abundance of colorful vegetables and fruits, and lean protein. Remember, your brain is largely composed of fats and proteins, so providing healthy sources of these nutrients is paramount for its optimal function. Prioritizing sufficient sleep, as mentioned earlier, is non-negotiable. Aim for 7 hours or more of quality, restorative sleep each night, to allow your brain to repair and rejuvenate. Effective stress management techniques are also crucial. Finding healthy ways to dissipate stress, whether through mindfulness, spending time in nature, or engaging in hobbies, can protect your brain from its detrimental effects. Diligent management of any underlying chronic conditions is essential. If you have conditions like anemia or thyroid dysfunction, working closely with your healthcare provider to manage them can have a direct and positive impact on your cognitive clarity. Consider supplementing with specific nutrients that support brain health. Resveratrol, curcumin, glutathione, and magnesium are some examples that may help alleviate neural inflammation. However, always discuss any new supplements with your doctor to ensure they are appropriate for your individual needs. Finally, and perhaps most importantly, do not hesitate to seek professional medical advice. If brain fog symptoms persist, especially if they are new, worsening, or accompanied by other concerning signs, consulting a neurologist or your primary care physician is vital. They can help distinguish between normal, age-related changes and potential early signs of more serious conditions, providing accurate diagnosis and guiding you toward appropriate treatment. It's important to remember that prolonged brain fog should not be ignored. Left unaddressed, it can potentially increase the risk of developing dementia. For those over 60, any persistent brain fog should prompt a gentle yet firm conversation with a healthcare professional. It is always wise to consider the possibility that these symptoms could be early indicators of conditions like stroke or dementia. Our goal is to approach these concerns, not with apprehension, but with a clear mind and a proactive spirit, by understanding what's normal and what's not, and by embracing lifestyle choices that nurture our brains. we can navigate the journey of aging with greater clarity, vitality, and peace of mind. Your brain, the silent conductor of your life's symphony, deserves this tender care. If you found this helpful, please subscribe and take good care of your health.